Good morning, everybody. It's Dr. Adana, and today we are here to learn a little bit about teething. So teething is one of those things that, of course, we all go through. Most of us don't remember, for a good reason, because sometimes it's really uncomfortable. But let's look at teething. Let's kind of look at when teething typically starts, some common symptoms, typical solutions, and then some natural solutions that you can take to, of course, make sure that teething is as comfortable as possible for your little one and for yourself as well. So teething for most kids starts typically like 6 months old. However, a lot of kids will start to show some symptoms earlier on. Some kids start to have the type of symptoms around 3 months, around 4 months, or even have little teeth start to pop out. So what are some symptoms that we might see? First and foremost, you might see your child wanting to gnaw on everything. If that starts to happen, then that should be a little, indication that, okay, maybe it's almost teething time. There are times that we'll see a lot of increased drooling. You might see a change in appetite. All of a sudden they were feeding however times a day and now they're feeding much more. Maybe they're doing it both as something soothing for them, plus they're going through a growth spurt at the same time. They might become a little bit more fussy. You might start to notice that a little bit more in the evenings or even throughout the day. And then one thing that sometimes parents worry about a little bit is this ear pulling. Kids start to pull on their ears, and sometimes we think, oh my God, maybe they have an ear infection. Well, why do they pull on their ears specifically? Well, if you think about your teeth and you think about your jaw, well, where do they all come together? They come together in this area. This area of your jaw and this area of your ear and this area of your neck, it's all basically connected, and your sinuses on top of it all. It's all connected. So it's uncomfortable for them, and they're pulling on the ear, not because they have an ear infection. Look, they might have a little bit of redness because they've got a lot going on with their puffy gums and their teeth coming through, but it's not the ear, it's just the pressure that they're feeling on their jaw that's creating that for them. So don't rush to think that it's an ear infection. Get it checked out, of course, if you're really worried about it, but most of the time it's because it all hangs out in that same area. Now, sometimes you might actually even see a fever or like some cold type symptoms come up too. Well, during that teething process, a lot is going on with the immune system, so just kind of monitor and watch and see what's happening. But just know, for some kids, you won't really even know, besides you'll see that drooling and that gnawing, and for some kids it's a little bit different. Now, what do we do on our end, and what are typical things that are done? So typically we might have some kind of pain relieving like gel or some kind of pain relieving medication, anything like that. Sometimes I know people will do some Tylenol, any type of, acetaminophen, ibuprofen, Motrin, anything like that, just to help kind of ease the child. If they have a fever, they might kind of bring it down like that. But typically, we want to make sure to support that body as naturally as possible. How are we going to do that? First and foremost, chiropractically, what we're going to do is make sure that that child's immune system, nervous system, the joints and the jaw, everything with the sinuses is completely supported. The majority of time with teething, we see a lot of interference or subluxations at the top of the spine. Again, we're back to that same area where we had that ear pulling, the sinuses draining, the ear draining, the jaw joint, everything's meeting there. We're gonna balance that out, and then of course we're gonna balance out the entire spine to see how we can best support it all. But this is gonna be crucial in making sure that it makes teething so much easier for your little one. The other thing we're going to do is there's a couple key things that I like to support with. One is Congaplex chewables, because that's just a wonderful immune booster for the body. 2, we can use either some thieves or some clove oil. Now those are completely diluted and done very differently depending on what age we're teething in, but those are going to help kind of give that numbness type of feeling. Your child probably won't like you because thieves and clove, they basically taste like Big Red, like gum, right? So it's going to be that cinnamony kind of, a little bit of that spice factor. But at that point, you're gonna go in, kind of rub against the gums. They'll probably fit with you for a little bit, but that's okay. And that's gonna help kind of soothe things and numb things down there. The other thing that I really like to do is a chamomile extract that we have from Standard Process. That we're going to dilute, again, depending on how old the child is. We've got some different dosages that we'll do. We're gonna dilute that into the breast milk. If they're drinking water at this point, we might add a little bit to the water and have them sip on it throughout the day. And of course, if you're formula feeding, then that could be something that's added to the formula as well. Chamomile is very soothing, it's very calming, it's very healing. It's going to be very effective in the evening as well, especially if they are fussy at that time. So let me grab those few things so I can show you. So here we are. This is our little chamomile extract that we have that MediHerb makes. Complex chewables, which comes from Standard Process. And then this is our Thieves Oil, which comes from Young Living. And in some cases, like I mentioned, we might use clove. So remember, teething is something that of course is inevitable. It's bound to happen. It's going to happen for quite a few years. So if you feel like these symptoms are kind of persistent at some points, it can be, especially when they have a lot of things coming to play. But remember, all this is a natural part of the body, so let's try to naturally support as much of it as we can. If you have any questions, please let us know and enjoy the rest of your day.